Okay. The recording has started. Hi, how is everybody? My name is Shay McMillan. I'm Vice President of Economic Development at the Youngstown Warren Regional Chamber. I'm very excited for this recording and this webinar today. We are planning on putting this on our chamber website to help guide those chamber members who are looking to do business in healthcare as healthcare providers with Anthem. And then we have a great success story with the CEO of QUICKmed Urgent Care, which I don't know if anyone knows this, but they're the fastest growing privately owned urgent care in Northeast Ohio.
We are.
So
We
yeah,
are.
very excited to hear from Lena. And then we have Karen with Anthem, who's put a fantastic presentation together to help guide you through how to do business with Anthem. I think the one thing I want to share before we get into it is these sessions that we're putting together have been created through the guidance of our DE&I committee at the chamber. We've collected data on our chamber members, and we've noticed that our largest sector of minority business enterprises are in healthcare. So we're very excited to start creating these series to guide folks into strengthening their network and being able to access resources and do business better in the Valley. So without further ado, I'll kick it off to Karen and she can begin her presentation.
Good afternoon, everybody. I am Karen Fuldauer. Let me go ahead and share my presentation for you so you can see it while I speak. So I am the provider network manager that is responsible for the northern portion of Ohio that spans from west of Toledo to south of Youngstown. I also work with a large group of contract specialists. When you go through the process that I'm about to talk about, you will probably encounter them well before you encounter me. They deal with the intake forms that we're going to go over. So just kind of hop right in as a new provider with you will want to do a provider enrollment application, and that happens through Availity. So we're going to talk about the provider enrollment application. We're also going to talk a little bit about Availity itself as we go along here. There's kind of two presentations that I've put into one because I think that they're go hand in hand nicely. So submitting an online enrollment application is the way to become a participating provider with Anthem, whether you're starting a new contract or already have a contract and need to add providers. One of the key jumping off points is your CAQH application and needing to be in line. So like I said, on Availity, you can use this as an existing or adding new providers. So right now, if you have an ancillary or facility, like an ancillary would be something like a large scale laboratory facility, of course, is a hospital or a skilled nursing facility, something like that. Those are not currently using this application. So if that's you, I'm so sorry, count yourself out on this one. But for everybody else, follow along and we'll go on a little adventure of how to use this. So jumping off, like I said, that CAQH profile is the number one thing that you need to do to get started. You want to go on caqh.com, make sure you have your ProView profile in initial profile complete or reattestation status. Those are the only two statuses that Anthem is able to use to move forward with. So something to note, because it happens frequently, is folks forget to include their primary specialty, and that's a mandatory field. So you want to make sure that that's in there. New profiles, if you're brand spanking new and have never completed a CAQH before, it's going to stay in the profile data submitted status until CAQH has approved your profile. So from there, you would get it into the initial profile complete or reattestation. So before you get started on Availity, once you have your CAQH all set, you want to register for Availity. It's a free website. Lots of different payers use it, not just Anthem. So it's not like just a one-off for Anthem. It's going to be a great resource for you when doing business in healthcare, generally speaking. So I know some of the screenshots I have are a little bit small, so I do apologize about that. We can get this out to anybody with Shay's help, or I can email you directly, however is easiest for you. We can get you this deck. But so once you register for Availity, you're going to need to make sure that you have the ability to add users. And there's some steps on how to do that included here. You log into Availity, and then you'll go to the More section, add users, and you have to be able to maintain users. You need the assignment of provider enrollment. It kind of shows you exactly what you're looking for here on this page. As we talked about your CAQH profile, one of the reasons that it's really important to have that done before you jump off is because a lot of that information is going to pull to your form for you. So you don't have to enter information twice or 3 times, you know, how some forms can be very duplicative. So this is a big help, big movement that we've made in the last few months to be able to do that for you guys, to pull that information over. Once you are ready to start, you're going to go to provider enrollment and go under payer spaces. You'll see an Anthem logo. You select applications, and then within there, you'll see the provider enrollment. So here's just kind of a screenshot of what that looks like. Again, it's www.availity.com. It's written out there for you. And just for the visual learners, what it looks like there. So the enrollment dashboard, we'll just take a quick look at it here. This is, once you do the steps we just talked about, this is where you land. You have a My Dashboard button. You can begin new applications. On the left-hand side, you have navigation for your recent applications, things that you have not completed yet to submit. Maybe you're working on them and needed to go find other information. And then the applications that you've submitted, you'll be able to track. Real-time status updates are available. So that's another fun thing with, we've recently just started this Availity program, so within the last handful of months. So I'm pretty excited about the updates. So pardon me while I shout from the rooftops a little bit. So once you start into the process, it's really a lot of just following the prompts on the screen and filling in your information. You're going to have your organization name on there. You're going to have your tax ID being asked for. You're also going to see what provider type perhaps you are. These are pretty broad at this point. There's more pointed specialties when you get into individual providers, but it kind of gets you on the right path here. Again, as I said, ancillary providers, this is going to reroute you if you select something that's an ancillary specialty. And then it's going to ask you, what are you doing? You know, are you enrolling? Are you joining an existing group? Are you creating a new group? So you just select that, and then from there, we'll zip right along to the actual application. You have your status bar on the left there. You have another different status bar on the top there. So each section has its own check marks and to help you know where you are along the process and how much further you have to go. So provider group information is going to be needed even if you're just adding a provider to your group, so we can map it appropriately. So there's more screenshots about that, just showing you what it looks like and where it falls within the flow. So once you get in your group information, you're going to start talking about your providers. You can add up to 5 providers at this time on Availity from the jump, so that's always nice. You can see here we have provider Jane Doe, and then they've started another one. You can, like I said, find the provider button helps you pull in that information from CAQH so that you don't have to retype all of that information over again. You're going to want the CAQH number and your NPI number for the provider off the rip to get going. So then from there, you're going to have the application is going to prompt to review the information, making sure it's complete, making sure anything that maybe didn't get pulled over from CAQH, you get filled out. There's going to be red bars to indicate something is required. Then it's going to be time for address information. Addresses, of course, are required because how else will folks know how to find you? Um, this step is going to capture all of the address information and contacts for it. Um, you're going to collect, at this point, we're going to collect the primary address, your correspondence address, a billing and remittance address, and then the office manager's contact information. That's going to, if you don't have an actual office manager, it's who's filling out that application for you, whether it's yourself or another individual. So from there, we're going to pick the networks. So this is your time. This is the flow of a brand new provider. So assuming that you all have not contracted with Anthem before, you'll be selecting what networks you want to participate in. They won't be 1, 2, 3, 4 like this. Of course, that's just an example, but it'll come up with the assorted networks that are available to you. If a network is not available for you, it won't show. So anything that's available, you should be able to click as long as you want to participate in it. If you see Medicaid out there and you're not a Medicaid provider, don't click it. Those kind of things, a little bit of common sense. If you have questions, you can always reach out. There's ways within Availity to reach out. You can reach out to me. You can reach out to the specialists that I can get you in touch with. So there's some support, but we tried to make it pretty straightforward for you. So from there, you're just going to be asked to review everything and make sure that you didn't make any silly typos. And you have the edit buttons if you did make some kind of error that you need to correct. So that's pretty straightforward as well. Hopefully you don't run into that, but we all know we're humans, we make mistakes, right? So then you're going to move on to stage 2 and up at the top here. And what this is going to do is you're going to upload documentation if any additional documentation is needed. You should be prompted. You can click and drag files or you can upload them. So that's, documents that are on your CAQH should be uploaded already. If there's anything missing, that's when you're going to do this step. Okay, so it's gonna prompt to review each of your providers very similarly to what we've already talked about on the group level. And if prompted, there's gonna be 3 steps within the servicing locations that you'll need to fill out. You wanna select the actual address where the providers are practicing, review each location to ensure the accuracy, of course, and then assign the providers to which addresses they're gonna be at. So a little bit of mapping, if you will. Okay, and then some applications are going to require contracts, like we've been talking about. So if it prompts you to supply the name and person authorized to sign a contract, that means you've started off on the right foot if you've never contracted with Anthem before. You're going to choose the right address for your signatory, or if you need to enter a completely different one, say, for example, your headquarters are in Timbuktu and you're practicing in Ohio, just make sure you have that Timbuktu address on there. So from there, that's pretty much it when it comes to the application. I knew I flew through that kind of fast, but the fields are really pretty self-explanatory. The big thing to note when you're done is you want to save that application ID, because if you're going to reach out to me or a contract specialist or anyone here at Anthem that with questions or concerns about your application, that's the key to the kingdom. That's going to help us map back to where in Availity your information lays. So from there, you can go back to your dashboard and you should be able to see the application ID there as well. So once you have all of that done, it's going to map to a contract specialist. I talked about them a little bit. They handle all of these intakes and are the ones that pull together the contracts to get back out to you guys to have a signature applied to them. Some things that you need to know after you've done that process, but before you get to see members, you need to make sure that you've done that application, of course, and that you've passed our credentialing. You can't start seeing our members until credentialing has given you the big thumbs up, and that's why the CAQH information is so very important. That's the information that they use to double check all of your credentials. And you're also going to want to take a look at the provider manual as you go along. It's going to tell you about the contract or the credentialing guidelines. And then from there, you want to make sure you have received a fully executed copy of your contract. So you've signed it, Anthem signed it, there's an effective date applied to it, and you've heard that you've been loaded to the Anthem systems. Those are all very important before you see our members so that you get paid properly. We want you to get paid properly. So some just quick troubleshooting. A lot of what happens when we run into snafus is your CAQH information may not be in the right status, as we talked about when I was jumping off there. You want to see that initial profile complete status. You have to have that primary specialty on there. So this tab kind of shares with you some typical errors that we see. If all things are right and you're still not getting where you need to go, a really good tool is Availity themselves. Anthem does not own Availity, as I kind of mentioned at the beginning of the call. Availity is used for a lot of different payers, so they do have their own support. 1-800 Availity. There's also a lot of different, maybe not a lot, let me back up, but there's a contact us page within Availity as well that you can shoot a message out and receive feedback. So that's just some ways to get around if you have run into a stumbling block. Let's see, we've already talked about that. Okay, so just to take a quick pause, if you're a home health care provider, that's not something that I handle and it does not come through that form. But on the screen here, I have Donna Carter's information. She is our enterprise contractor for home health. So you can reach out to her by email. It's probably her preferred contact. Her phone number is on here as well. And she can get you pointed in the right direction if you want to be a home health aid provider group with Anthem. There's just a few more things. I don't know if anyone here is a home health service provider, but something that they've asked me to include just off the rip is that prior authorization is huge when it comes to home health. You have to have a prior auth whether or not you're a home health provider with Anthem if you want to service our members, whether it's in network or out of network. So that's just something to note. And there are some information, there's a link to find the information should you need it. Okay, so that is, I blew through that pretty quick, so I can take a pause if we have any questions.
Karen, I had one question. You
Sure.
mentioned how critical it is to make sure they save the application ID when applying. Assuming someone maybe misdocuments it or loses it, would they go through Availity to get that ID, or how could they
Yeah.
recapture it?
Yeah, I'm going to scroll through these real quick. So sorry about anybody not looking here. Let's see here. So you get the application. All right, back here at the beginning, there was a screenshot that had some navigation information. So it would be under your submitted applications. You can go to your dashboard after you're in payer spaces and you're in the enrollment dashboard. You would see it in your submitted applications. You click there and that number should come up.
Excellent. I see Carlita has her hand up.
Yes, my question is, when you're talking home health, you're talking about home health agencies, not a provider who sees homebound patients.
I believe that would be stated correctly. When you say a provider that sees homebound patients, are you talking about like a podiatrist per se that goes to the home and makes house calls, or are you talking about an aid level?
No, I'm talking about provider level. Like I am a primary care provider and I do have some home patients that I see as a primary care provider at home because they don't get out.
Right. Okay. So you make house calls. Gotcha. Yeah.
Right.
That's not Donna Carter. That's still me. Yep. You would still go through the same availability process, et cetera. Anybody else?
I had one other question, Karen. I don't know if it's kind of open-ended, but do you have any suggestions on when to contact Availity versus when to contact you for support? The clear distinction.
Yeah, that one, that's a good question, generally speaking. If you are getting inavailability and availability is giving you errors, that's when I would say reach out to availability and they can instruct you a little bit. If you have completed everything through availability and you're just waiting to hear and you feel like you've been waiting longer than you think you should, you can always reach out to Anthem directly. And if it is something that Anthem is like, well, that's not us, it's Availity that you need to talk with, we are more than happy to make sure that you know where you need to go with that. It can be a little confusing, but mostly if it's an error that Availity is giving you based on information they don't seem to be receiving or something, then you want to reach out to them directly. I hope that answered enough. Sometimes it's a case by case basis, but a lot of times, if you just reach out, we'll get you pointed in the right direction.
Hey, Karen, it's Nancy. So what would you say is the average standard turnaround time that a provider would hear back once everything is completed correctly? They have all the green lights and availability, and they get that submission number. Is it a week? Is it 10 days? Is it 2 weeks? Like what's a reasonable amount of time for them to expect to hear back?
Yeah, that's a really good question. And right at this moment, because the availability system is so new, I don't have a really good pinpoint for that. But what I would say is, once you get your availability, you get your application ID number. At this point in time, I'd say give it at least 2 weeks for something to come back to you, an email, a hello, a something. It may take longer than that because this is new and we have just made some transitions here in the networking department. So there are a lot of balls in the air. So it may take a little bit longer than it will once we get some of the growing pains worked out. But at this current time, I would say give it at least 2 weeks to have somebody reach back out to you. If you haven't had somebody reach back out to you, um, you can look at your status for the application, see what that looks like. If it looks like it's changed, you're probably in a good place. If it's just sitting there and nothing has changed, you may want to reach out. You can reach out to me and I can redirect you to the specialist because I don't actually have the access to touch the applications, but the specialists I can get you in touch with will. Um, and they pull together the contracts and get them out the door. So there's a lot of moving pieces and parts right now, like I said, with some growing pains and some getting things on track. But this application process has been going a lot faster than the old one um, when it's stood up properly and everything is in line. So for now, I'll advise 2 weeks and know that that could change over time, maybe less, maybe more once we settle into a good rhythm. But what I don't want you to do is sit out there for 2 months and just leave it sit and go, nothing happened. Because sometimes the squeaky wheel that needs oil will get it if you speak up. So don't want to leave you in the lurch at all. All right, so I think from there, let's just hop in. This is going to be a relatively quick overview of availability in a general sense. Availability does more than just that initial application that we went over. So let's take a look at what we can do here. It's a tool, like I said, used for other payers as well. How they utilize it may differ, but a lot of things line up So we will take a look here. So you have the ability to mark things as your favorites. A lot of people use this for when they, if you have somebody that's the person that adds your providers, that person's probably going to have the application tool on their favorite, so they can just navigate straight to it. If you are the accounts receivable person, maybe you have the claim payment information as your favorite. So there's a lot of different things that you can do, and we'll take another look at that. Something else that's huge that I'm going to pause before we get into all of the things is the help and training, finding help, payer help, getting trained. Availity has a huge catalog of things that are very straightforward. They're not overwhelming to learn how to use the tool. So I'll give you the big overview, but the individual tasks, there's quick guides to everything that we're going to take a look at. And you can just search by a keyword and find something that you're looking for. So like I just talked about, keyword searches, I almost forgot what was coming up next. So you can chat with the with Availity, you can chat with the payer. It depends on where you select to chat from. So this is one of the ways that you would get support if you're having trouble with Availity. You can get support via chat, or you see it has chat with payer. That would be used for claim status or questions about payment. That would be a good place to start. You see there's that heart icon. That's because somebody has this set as their favorites, the person that took the screenshot for illustrative purposes. So all you have to do is, there's usually a blank heart. You just click it and it'll turn red, and then that's how you know that it is one of your favorites. A little bit more about the favorites here. Like I said, blank hearts, click them, turn them red, and then they'll be on your favorites so you can quickly navigate to them. And we talked about help and training, so I'm going to skidoo right past that. So on the dashboard, they bring up the whole catalog of the Learning Center. So you can, like I said, learn about basically every facet that Availity offers. Self-paced, whether it's video or one pagers, or they have it all. They have it for any kind of learner that you are, it seems. So as we get into the actual things that you're able to tangibly do, we're going to be able to check eligibility and benefits within Availity. There's the patient registration selection, and you can click on that from the main menu bar. Then you would select eligibility and benefits from the drop-down that comes down. So then you can also submit your claims. If you're a professional provider, you fill in the information requested via the form. Rather than having to fax or mail claims in, you can do it directly through Availity's clearinghouse, which is pretty good. It's a good improvement from not being able to do things electronically without external help, I suppose you could say. And then you can do professional claims that are government business, so like Medicare. You can also do those claims on here. You can check claim statuses. So there's just an example of a patient. There's a claim here that was denied, one that's finalized. So you can send secure messages. Say we're selecting this denied. Yeah, see, that's what's up here. If you have questions, concerns, etc., you can send a secure message on it and explain. Let's say, for example, this was denied and you have your prior authorization. Perhaps it's denying for prior authorization, but you have that number already. So I would do a secure message and say, I have that number, here it is, please reprocess, or something to that effect. So instead of having to call and sit on hold and talk to somebody and then maybe have some issues on the phone and just kind of a waste of time sometimes to sit on the phone for too long. This can speed up that process. You can also do a dispute as well, more of a formal dispute. So really handy. And like I've said, Availity has training on what anything you want to do. You could do the quick word search for verify eligibility. You can find out how to do that, etc. So the dispute functionality, let's talk a little bit about what disputes and appeals are. The dispute option allows you to follow up on a claim where you disagree or are not satisfied with our final decision. You can add up to 24 additional claims to an appeal for the same member, the same provider for the same reason, to kind of lump things together so you don't have to do all of those individually. You can follow up by way of using the appeals application. It's important to note that it does not apply to clinical appeals, medical necessity, or I'm sorry, I made a bad example earlier. It does not apply to authorization or prior authorization. So you will need to do those through the information that's included in the provider handbook. I'm sorry that I gave you a bad example off the top of my head there. But so those you're going to look in the provider manual, and that's available on anthem.com under the providers link at the top, and you'll be able to access that. So again, training opportunities at every turn in Availity, help and training, find help. If you want to learn more about appeals, just type in appeals. You can try reconsideration as another good keyword. And then we have live and on-demand webinars to get trained as well. So like I said, just an oodles and oodles of support available to you. So payer spaces is where you find a lot of information with specifics to Anthem. So, right here they have some little examples of Health Plan 1, Health Plan 2. You may end up seeing a bunch of different health plans that you are enrolled with. Anthem would be one of those, and you'd see, the typical Blue Cross Blue Shield Anthem logo there. Once you click on it, you find the payer space landing page. It's got your applications, your resources, your newsletters. If you recall from the last presentation, applications is where you find the provider enrollment tab. Also, you have different resources. News and announcements are going to be available to you as well here. Let's see. So you can, in applications, you can get your remittancy inquiries. And again, that's another one that a lot of people will favorite because you want to go to them frequently and know what your money situation is with your remittances. So images are available for most members. Images can be saved to your PC or printed. They go back 24 months, and the access to view them is you have to make sure you have that role set up of claims or claim status. That's something that whoever initiates your Availity account would have access to set up those allowances for you. And again, if you need support with that, Availity is going to be where to go for that. And just claim status listing, another great one to have on favorites. There's not a whole lot to see here, just that they're there. And once you go into them, there's a lot of things that prompt you on, do you have a claim number? Do you have a member ID? Do you have, lots of ways to get to where you want to go. So we're not going to run through all of that. But again, the Provider Learning Hub, on-demand stuff, just a great access point to get to those self-service trainings. So that pretty much covers all that. Like, again, I know I went really fast. The best part about Availity is the amount of support that it offers with training, and then the tools themselves once you learn how to use them. Any questions now that I've just verbally vomited all that information on you?
I have a question or a concern, and I'm not sure that this is the place. I don't know what else you're going to go over, but my comment is Anthem, Blue Cross Blue Shield, is the hardest system to try and find to talk to somebody live. That's my number one concern. And my second concern is I was denied anything on doing PHQ-9s or GAD-7s, which are absolutely in my scope of service. And I don't know if there's anything that you can address with those two things. Sorry.
No, don't apologize. I mean, that's part of what I think this conversation is supposed to be about, to make sure that we get you pointed in the right direction if needed. So the first thing that you mentioned, having a hard time getting to a person. We try to have a lot of tools available to you so that you don't have to call. However, I am one of the people that is a direct line for the entire northern part of the state. I may not be the right person, but I am a person that knows the other actual people. So I can probably get you directed to where you need to go depending on what the question is. And then, because you do have me, as I'm in charge of the contracting relationship. So if you have contractual language questions, that's me. If and then you have a provider relationship um, rep, and I believe for your general area it's going to be, her name's Angela, and I can get you her information because she's like the best first stop. She's going to be, like I said, that relationship liaison, if you will. So we can get that information to you. And then when it comes to the other piece that you talked about, I am not clinical, so I didn't know what you were saying that you were denied for. So please forgive me on that. But it sounds like something that maybe we need to get some kind of connection done with. I don't know whether it was a credentialing issue. Just something out the gate to know when it comes to being denied. Like for credentialing, is if you're not board certified, we have a very hard line on not accepting providers that are not board certified. So I'm not sure if you fall in that category or not, but that's just something to note. I'm going to stop sharing for the moment, and I'm going to get, because I think you all fall in Angela's territory. So I'm going to put in the chat here once I grab her email address so you can touch with her. And then once I do that, I think that my portion is going to be done, and then Lena will speak. So let me get that address for you.
And what is Angela's title, Karen?
Yeah, her title is account. Let me see. Hold on. Let me back up. It's changed recently. Provider relationship account consultant.
Thank you.
Sure. She is typically, that position is who would be doing one of these kind of lunch and learn situations. But she didn't have the bandwidth, so I thought I would step in and give it a whirl. And I hope that I hope that I did it justice for y'all.
We
Here.
certainly appreciate your time. Thank you.
Absolutely. So here's Angela's email address. She's a good first stop for anybody that is already contracted, that's having issues. If you're not already contracted, go ahead and fill out that form like we talked about. It'll route to a contract specialist. And if they need to, if you have questions that they can't answer about contract language or anything like that, that's usually when they loop me in. Okay, so if that rounds out all of the questions for me, I'll go ahead and let Lena take over.
Hey everyone, I'm Lena. For those of you that don't know me, my name is Lena Esmail. I am a dual certified nurse practitioner. I specialize in family practice and critical care. And a while ago, about 5.5 years ago, there were rumbles that Northside Hospital was closing, as you all might remember. And in response to that, I happened to be working in the ER. And I asked a bunch of folks there, my colleagues, hey guys, we're getting a lot of patients here that aren't necessarily emergency department patients. There really are urgent care patients. Why don't we open an urgent care? And the response I got was, oh, urgent care would never work in this town. People will only go to ER because that's all they know. Subsequently went out on my own and opened my first location, a stone's throw from where Northside Hospital was. And we subsequently were able to grow to currently 10 standalone locations, 10 school-based clinics, and 4 locations in the works that will be open in the next 4 months. So as Shay mentioned, we are the fastest growing private, and we might be the fastest growing urgent care period in Northeastern Ohio, but who's counting? We are very proud of what we've been able to do, especially because our focuses on really 3 areas of need, and that includes blue collar healthcare, urban healthcare, and rural healthcare. And what we basically did was we looked at the lay of the land and we said, what are the needs of the community that we're in or that we serve, and how can we capitalize on the needs of the community by giving access to care? And that's how we decided to place our location. So our Liberty location was, a hybrid of need for both urban and the blue collar, and then we started growing outwards, going into the school districts that were primarily urban and rural. And we've since grown. We're in 8 counties now, soon to be 10, and we're really no, soon to be 11 actually. We're heading down to Dayton and Zanesville, and we're just really excited about the growth we've been able to do while being able to help the communities that we serve. A little story about credentialing with QUICKmed. When I started credentialing, we hired somebody to do our credentialing and our contracting. And myself, being in a place like Carlita, you might have been a couple years ago, I didn't know anything about credentialing and contracting. I just knew that we had to get done so that the payers would recognize me and my organization, or at the time, me and my location, as valid so that we can get paid. And I hired a third party, and 6 months into it, everything's great. We're contracted and credentialed, we're moving and shaking. A month before the opening, come to find out, none of our locations were credentialed or contracted, and none of our providers were contracted and credentialed. So myself and my billing manager, we took the reign, and we credentialed and contracted ourselves. And what that did for me was it gave me a lot of value in understanding the process. First and foremost, it taught me the human effect of being able to contact somebody at the healthcare organizations or the insurance companies that you want to contract with, to be able to have that human effect. We had to hold our claims for 2 months because we weren't contracted or credentialed. A lot of that is based on your relationship with your payer representative, them understanding why you had to hold your claims, them understanding the demographic that you're serving. That became very important to us. When we would call the folks at Anthem, they were very receptive to the fact that we were serving an area of healthcare inequity, and that we were taking care of a lot of folks from Youngstown. And because of it, they said, hey, we're going to let you hold your claims and reprocess them because we understand the situation that you were in. Now, with that being said, that's not a blanket rule for Anthem. That's simply because I established a relationship with the Angelas out there, and they understood where we were coming from and what had happened with us. The biggest piece of advice I will tell all of you that are working on getting contracted and credentialed is that people like Anthem, or people that work for Anthem, they're not your enemy. They can make you very upset. There are times when many payers make us upset because things happen, right? You don't get paid on time, you get underpaid. There are delays in your contracting and credentialing, but there's always a human on the other side that can put things into motion or help you understand what's happening. And I think that when we first started the process, we interpreted Anthem as this big, scary entity, just like we would a United Healthcare, just like we would Cigna. And once we started talking to people, when we started talking to the Angelas and the Karens and everybody else out there, I recognized as somebody who values the principle of networking, that establishing key relationships with these folks and letting them know who you are, what you do, and who you serve makes a tremendous difference in the dissemination of being able to acquire what you're looking for. I know, Coletta, you had mentioned that you're not being compensated for some of your depression screenings that you're doing, which is within your scope of practice, and I know it is. I think you and I met a few years back. The first place I would start is I would ask Anthem who is eligible, because by doing so, you'll be able to identify what their standards are and find out if it's just a matter of, for example, if a physician's assistant is eligible, well, we should be eligible, right, as family practice NPs. So the first part is find out who is eligible. Maybe it's a blanket rule for physicians. It's harder, I know, in my experience, to change or get compensated for blanket rules that apply to physicians, not to advanced practice providers. But when they apply to some advanced practice providers and not others, you have more of a leg to stand on. So I think that's where I would start, is find out who is eligible. Another thing that Karen mentioned was about board certification. I know that's more applicable for physicians than it is nurse practitioners, because you can't be a nurse practitioner without being board certified. So something tells me it's either something that applies to some of us but not all of us, or none of us. And if you can find out what that is, what that designation is, that's going to help you be able to apply the principle of what's within our scope of practice back to Anthem. Some things like, what's that? Okay, he can come back. Some things like, I know, for example, we have a high complexity lab, which is very unique for an urgent care. We run PCRs. We ran them before COVID. So we had that advantage when COVID hit, because we had, we had the testing that hospital systems didn't. With that being said, there are not Anthem, but there are other payers that won't let a nurse practitioner order this test, which makes absolutely no sense, right? So for a while, we couldn't figure out why we were getting rejected from Medicare. It's just a COVID test, or it's just a full respiratory panel. And the test was coded as a high-level chemotherapy test in Medicare's profile. So it was simply a coding error. They subsequently took it all the way up, and it took a couple months. We held all our claims, and they got it all corrected, but it took us finding that one person within Medicare that would listen. Hey, you have to understand what this is. This isn't a chemo test. This is a standard respiratory or urinary test. And sometimes, Carlotta, it's as simple as that. Find out how it's coded and who can apply the code, and that'll give you insight as to what's going on within Anthem and what their mindset is with it. As a whole, we've had a very good relationship with Anthem from the very start, then all the way into COVID, where we were swamped with new testing and no codes. So we had these COVID tests, we didn't have codes for them. We had these antibody tests, didn't have codes for them. Collection didn't have codes for them. So what we did in good faith is we said, we're going to run these tests, we're going to provide care to these patients, and we're going to bank on the goodwill of our payers to compensate us. And that's exactly what Anthem did. We ended up billing with codes that were incorrect because we didn't know what to use. Our rep at the time reached out to us because she saw how many volumes we were putting out and said, hey, just hold your claims right now. The code doesn't exist yet, but it will. And as soon as it does, I'll let you know what it is. And she was absolutely right. The code came around a month or two later. We were able to bill appropriately. But if it wasn't for that human connection that we had at Anthem, we would have been blind and we would have been completely lost as it pertains to correct billing standards. Another thing that becomes very pertinent for any provider on the call is compliance and understanding when you get a chart audit or a request for a medical record, what that means. 99% of the time, those type of things always start as an educational opportunity. So Anthem wants to say, let me see how you're charting so I can tell you if you're doing it correctly. Anthem is not going to pull your contract if one of your charts were not coded correctly, or if you up-coded or down-coded, whatever the case may be. What they want to do is educate providers on correct coding standards so that moving forward, they're paying out correctly and you're getting compensated correctly. That was a learning curve for us because after COVID and during COVID, we got a lot of medical record requests because we were putting out so many claims. Algorithms usually cause those medical record requests to populate. It's not usually a person saying, oh, look how many claims QUICKmed is putting out. It's almost always an algorithm saying, whoa, they're putting out more claims, like triple as much than they did last year. What's going on? So then they start to ask for records to make sure everything, is done appropriately. And, when things like that occur again, leverage your relationship with your representatives to ensure that what Anthem is asking for is what you're providing, and what your practices and policies are enhanced by way of looking for what the commercial payers like Anthem are looking for. If you're, if you're in complete compliance and you have a good relationship with your payer, then you know that if you're doing it right here, you're doing it right for Medicare, you're doing it right for Medicaid. And if you know anything about compliance, you want to make sure you're doing everything right for Medicare and Medicaid. So the commercial payers are your friends, right? They're going to be more lenient when it comes to teaching you how to apply aspects of your chart that makes it appropriate for how you're billing. So that's another piece of advice I wanted to make sure that I gave everybody on this call. The last piece of advice is going to be, make sure that you don't go at it alone. When you're a new practice and you're starting to credential and contract, use a consultant, use a biller that has the experience. However, collaborate with them in the process. Don't let them do anything without you understanding what they're doing and how they're doing it. Because our mistake was that I blindly trusted somebody I pay to get this done. And 6 months down the road, nothing was done. And I was just like, oh yeah, I believe you. Yes, you're good. Why would you lie to me, right? She was banking on another employee who was completely lying to her and then quit. So she wasn't even doing those checks. So there was like 2 levels of trust that were broken. So make sure that you ask the right questions. You ask for people to show you what they're doing, how they did it, and have the same access to Availity or whatever else it may be that your credentialer has, so that you can keep posted on it. I wouldn't go at it alone, but I wouldn't blindly hand it to anybody else either. And again, just like Karen said, the squeaky wheel gets the oil. So if you're not getting, say you're getting credentialed or contracted with other payers and they're coming through a little bit quicker and you're not getting word back from Anthem and you feel like you should, reach out to Angela, reach out to Karen, find out, if they can't help you, they will put you in contact with somebody who can. And I think that's the general principle of how my network of insurance payers works. If you can't help me, I know that if I call you, at least you're going to tell me, hey, this person can help. They're going to punt you to somebody they know can help. So, in a nutshell, we've been very fortunate because we've been able to not only help the communities in need that we serve, but we've been able to leverage our networks through folks like the folks at Anthem to be able to grow and build relationships. We carry the same tax ID with every location, so we don't have to recontract with every location. However, I just want to warn you guys, if you open a new tax ID, you have to start the process all over again. So be mindful of that. It can be a matter of ease, but then there's a liability that changes with having several locations under one tax ID or having multiple tax IDs across the number of clinics or practices that you have. And those are all questions you can ask your consultant, your biller, and even your Anthem